Authorities in India are launching a massive coronavirus survey of the entire population of the capital, Delhi. That's 29 million people, and the aim is to test everyone with symptoms by July 6. Delhi has become the worst-hit city in India with more than 70,000 cases. Police will be deployed to enforce physical distancing and prevent the mixing of the population in the city's 266 containment zones. India as a whole has again confirmed a record increase in COVID-19 deaths in the last 24 hours. Well, to find out more, let's bring in our correspondent, Nimisha Jaswal from Delhi. Nimisha, record numbers of new infections, overcrowded morgues, overburdened hospitals. Was it a mistake by the government to lift the strict lockdown measures at the beginning of the month?
Well, Gerhard, the steep rise in the number of coronavirus cases makes that concern very understandable. But we must not forget the circumstances that were prevailing during that harsh lockdown. There were thousands, there were millions that had been put out of a job. Many of them were fleeing back from urban centers to their villages on foot, in buses and trains. And there were deaths not just caused by the coronavirus, but also by hunger and accidents. So India did not feel it was possible with an economy that was already flagging to continue such a harsh lockdown. The World Health Organization did say that restrictions like these will not defeat the virus, but will buy time. India did ramp up testing from 1,000 per day to about 150,000 per day. PPE production has increased, but there are serious concerns about healthcare infrastructure, which, as you pointed out, is crumbling.
So what else is the government now doing with respect to the new record figures?
Well, Gerhard, the national government is trying to set up cooperations with state governments, relying on India's federal powers in a fashion. And recently, once again, the Prime Minister held his sixth video conference meeting to come up with the best strategies across states. To do so, there are also funds being announced. Very recently, the Prime Minister announced a significant fund directed at creating employment for all the migrants who have gone back to their villages and creating employment within these villages. However, it's also important to note that the government is holding firm on its assertion that the lockdown, the timing of it, along with the lifting of it, is perfectly justifiable, that it actually helped prevent thousands of deaths and many more cases, and that the way forward has to be for India to find a way to live along with the virus. But of course, there's a larger crisis that's being created, not just from the lockdown, but from the coronavirus as well, that India has to focus on.
But Nimisha, the government still projects that cases in the capital area alone could go up to more than 500,000 by late July. If many hospitals are already at capacity, is India heading for a disaster there?
Well, Gerhard, Delhi, for one, is trying to ramp up screening and testing significantly. As you said, there's an attempt to screen every household by the 1st week of July, and big locations such as stadiums, ranging from stadiums to trains to even luxury hotels, are being converted into COVID wards. So Delhi is really trying to push back, but critics are concerned that this is more firefighting, that these temporary structures may not be enough. And the most concerning thing is that healthcare for every other ailment and disease has been completely suffocated. We're hearing reports of people ranging from pregnant women to tuberculosis patients dying just looking for treatment. And this is a crisis which will be the true challenge, perhaps, for India to manage.
Nimisha Jaswal, thank you. Time now to bring you up to speed with some of the other developments relating to the coronavirus pandemic. In Germany, residents in outbreak hotspots face travel restrictions to some other states within Germany, as well as to Austria. Australia's second biggest city, Melbourne, has started a testing blitz in 10 districts designated as hotspots. Health workers are going door to door to provide tests to more than 100,000 residents. And in the Netherlands, the government has announced a significant relaxation of measures. High schools are reopening, sports fans can return to stadiums, and sex workers can resume their trade. The US has recorded its biggest daily increase in cases since April. New infections are climbing sharply in several states, including Texas, Florida, and Arizona. The governors of New York, New Jersey and Connecticut have now ordered travelers from virus hotspots to quarantine for 2 weeks on arrival.
Back to square one. That's how this Houston hospital in Texas feels about its coronavirus patient count tripling in the last month.
People got complacent. People got a little bit overly confident in our ability to manage, more normally, and it's coming back and it's biting us.
Several other states like California have also set new records for increases in infections this week, while other states like North Carolina have broken previous records for hospitalizations.
If we don't do anything, looking at some of the models coming out of the policy labs and the University of Pennsylvania and elsewhere, they look apocalyptic.
In Florida, the single-day case count has surged to triple the level from earlier this month. Residents there brought traffic to a standstill while lining up to be tested at drive-up clinics.
I think it's transmitting quicker right now than it did in March and April. So we got to figure out whether, if there's relationship or what, but you do see a lot of spread.
The timing of lockdown measures being eased is taking the blame.
The fact that we did it so quickly and with so little thought and so little planning is that now we very likely will have to close again. So long-term thinking suggests if you do it correctly and you make sure that everyone plays by the rules, if that doesn't happen and we have to close again, then a lot of places that probably could have made it now won't.
Despite huge demand to keep the economy open, health experts are calling on restrictions to be reinforced.